Welcome to another session of ISOP Nigerian Chapter webinar. My name is Martin Agoje, the National President of ISOP Nigerian Chapter. So today we shall be discussing mental health and substance abuse. And to lead us in this session is Dr. Saadatu Adamu. And Ejikeme McBishop Oguje will be moderating this session with me. Ejikeme is a very familiar person in this ISOP webinar. Ejikeme is the Assistant General Secretary of ISOP Nigeria Chapter and a member of the editorial team of the ISOP Nigeria Chapter. So before we introduce the speaker, let me once again remind participants that information from this session and every of our webinar does not constitute medical or treatment advice. The views are those of the speaker and not necessarily those of ISOP. At this point, let me quickly introduce the speaker for today. Dr. Saadatu Adamu is a mental health counselor working with victims of human trafficking, rape, substance and emotional abuse. She is a graduate of Industrial Design and Motion Pictures from the National Film Institute, an affiliate of Abubakar Tafawa Balewa University in Bauchi State. She obtained a postgraduate diploma in education and MSc in educational guidance and counseling from the Nasarawa State University, Nigeria, and recently conferred upon a degree of honorary PhD in management and leadership from the American Management University. She is a certified human resource management professional from the UNICAF University, Cyprus. Dr. Adamu has a unique combination of high-tech training and expertise in counseling skills, project development, strategic planning, consulting, and project research. Her working career started at the NAFDAC Green Pages, where she served as client service executive and zonal coordinator in Abuja. Dr. Adamu has attended and organized international conferences as well as local conferences, workshops and seminars on human trafficking, counseling, and mental health. She is the author of the book, Break the Silence, a mental health advocacy material for secondary schools, and has written publications internationally and locally on counseling and mental health. In 2021, she facilitated a GBV project on awareness and campaign material for primary and secondary students in urban and rural schools, initiated by Spotlight Initiatives and sponsored by the UN and EU through UNESCO. And since 2018, advocacy and counseling has become her focus through school campaigns in partnership with Citizens Commission on Human Rights. Dr. Adamu is the founder of SDF Post-Care Rehabilitation Home, president of Psychotherapeutic and Counseling Research Institute, and the CEO of Mesa Legado Limited. Her work has won her several awards, and she serves in different boards. She is the current vice chairperson of Counseling Association of Nigeria, FCT chapter, She's also a member of the American Counseling Association, International Society of Substance Use Professionals, and the Global Mental Health Action Network and World Drug Foundation. Please join me again as I welcome Dr. Saadatu Adamu. And let me quickly remind participants to please, while the presentation is going on, use the chat box to send your questions. After the presentation, Ejikeme will guide us through the Q&A session. So once again, we are glad to have you at this webinar as I hand over to Dr. Adamu to take it over from here. Thank you.
Thank you very much. Good afternoon again. And thank you for this opportunity. For me, mental health is a very important and deep subject of matter. And as we will be looking at it today, we'll also be looking at substance abuse. So the question is, I will ask a question. What is mental health?
If you click on your slides.
Yeah, can I reduce this? Okay. All right, please, can you do that again?
I think you should just need to click on the slide. Oh.
Okay.
Click on your presentation and then you should be able to move forward to the next slide, just on the slide itself.
Okay, I see.
You should just need to click on the presentation. If you, oh, that's fine. Yeah, that works. And if you click on the, can you see your slide?
Yes, I can see my slide, but I click and then it's not moving.
Okay, in the bottom left corner of your slide, there should be an arrow, bottom left of the slide itself.
Yes, I'm there, but I can't see.
Okay, can you exit the full screen of your slide then, and then put it in slideshow mode again, perhaps? Oh, there we go.
Okay.
Perfect.
Okay, that's good. Okay, so thank you so much, and sorry for that. So today we will be looking at mental health and substance abuse. And our learning objective will be learn about the concept of mental health, have a better understanding of the importance of mental health, learn about dual diagnosis and common dual diagnosis, connections of mental health and substance abuse, learn about risk factor to substance abuse and mental disorder, preventive measures and way forward. And then, of course, the last objective is understand mental health treatment and service supports. So many times you hear people say mental health has to do with people roaming on the streets. But no, mental health is our day-to-day life, is what we do on a daily basis. So mental health is a part of everyone. Mental health is something to look after. Mental health is real and complex. Mental health is really important. Mental health is something you can change. Yes, you can change. You can work on one of the things. If you definitely find something not right, you can work on it. Now, mental health isn't a sign of weakness. Mental health, of course, isn't a sign of weakness. It is not, is always in your head. So it might not be real, even when you feel it. Sometimes you can just snap out of it Well, I don't think so. That's not how it works. Mental health, you just can't snap out of it. Always a negative thing. Well, most times it's not always a negative thing, as seen by individuals and people around us. Mental health isn't something to be ashamed of. Yes, and that's why we're having this conversation today. Most times when you start a conversation on mental health, like, people tend to not understand what you are talking about. They feel like, oh, you have to be on the street. I remember posting this on my Facebook page. I know how many people always comment when I post stuff on my Facebook, but to be surprised, I didn't see any comments. I only saw likes and likes and likes. That means there's something that people are running away from, something that people don't want to be seen associated with. Nobody wants to be seen around that. You don't want to be stigmatized. You don't want anybody to say, oh, she made a comment. It's possible she's going through something, or someone around her is going through something. There is a need for us to always create awareness and talk about mental health. Now, according to WHO, it says 1 in every 8 people, or 970 million people around the world, are struggling with some mental disorder. It could be anxiety, depression, or whatever it is, but 1 in every 8, 970 million people struggling with mental health issues. So I feel it is important to talk about it so that we can reduce the misconception and stigma that can also encourage those who are struggling to seek help. It is important for us to discuss mental health so that family members, caregivers, and loved ones can understand the impact of mental health and how it affects our daily lives. It is also very important for us to understand mental health because it helps individuals to understand the impact on their self-esteem, relationship, and ability to function in everyday life. I have seen people struggle in the workspace, and when you say, oh, maybe you need to see a counselor, they're like, no, I don't have mental health issues. No, I don't have anything. Don't tell me I need to see a counselor. Because we're here to talk about it all. We're creating awareness, but people are yet to come to terms with reality that whether we like it or not, mental health is our daily activity. It is our everyday struggle. It is what we do on a daily basis. When you wake up in the morning and you wake up on the good side of the bed, of course you'll be happy the whole day. Everybody will be happy, your staff, family members and all that. And then if you wake up on the wrong side, everybody will feel it, and that is mental health. So there is a need to talk about mental health, I will say. Now, what is mental health? Mental health is a state of well-being in which the individual realizes his own abilities to 1, cope with the normal stress of life, 2, can work productively, and then 3, able to make a contribution to the community. So it means that if you're able to cope with life stressors, remember that whether we like it or not, challenges would definitely come. So, but when they come, how do we manage ourselves? If we're able to manage ourselves, very well, then it means that, okay, we're on the right track. That means mentally, we can say, yes, we are okay. And then mental illness is any disease or condition that affects the way a person thinks, feels, acts, behaves, and then ability to relate to others and to the surroundings. An example of this is someone who is struggling with anxiety disorder. Of course, most times the person is irritated. The person is always afraid. The person is always hallucinating. The person is always struggling with, one thing or the other. And then for someone who is also maybe just had, I just give an example. Maybe you wake up today and then unfortunately you get a bad text message or something that is really terrifying. And then the whole day you carry that thing on your head. You're not smiling. You're not talking to anybody. And then the next morning you lock yourself in the room. You're just isolating. You're not having conversations. You go to the office. You have mood swings. You are yelling. You just don't want to have good relationship or communicate, in that proper channel with others, then maybe something is not right somewhere, because mental illness is how you think, feel, and act. Meaning that if you're not able to manage certain things because of maybe situation or experiences or traumatic events, then it lasts for so long, it lasts for maybe 2 weeks. 2 weeks, you can say, okay, well, if someone is going through something for at least 2 weeks, you can comfortably or look at the person and say, maybe you need some form of therapy, because 2 weeks is a long time for an individual to be going through something. You can't be sad for 2 weeks. If you're sad for 2 weeks, straight 2 weeks, maybe we should ask the question, what is the problem? So talking about concept of mental health. Concept of mental health basically is concept of normality. Now, absence of illness, optimal level of functioning, dynamic interactions between biological, social, and psychological factors. They are concepts of mental health. Now, medically, looking at maybe if there's an issue, whether it's hereditary, whether it's genetic, whatever it is, just looking at something that could disrupt, the system medically. And then maybe psychologically, it could be experiences, maybe environment, it could just be anything. And then socially, of course, life experiences as well, environment, and then all of that. Those are concepts of mental health. But the main concept is the normality. If 3 things are working, then it means that you are on the right track. I feel that it is very important for individuals, caregivers, professionals, family members, to understand that ICD-10, International Classification of Mental and Behavioral Disorder diagnostic guidelines, is very important, especially for providers, that's professionals. It is important for you to know that before you diagnose an individual, you must understand where the person is. You don't just come and the person sits in front of you with stories, oh, I've not slept for 2 days, and I've been taking coffee and I feel this is, and then you just say, oh, I think you have, you're struggling with mood disorder. Oh, I think you're having issues with disorder of adult personality and behavior. No, you can't just diagnose an individual based on what he has said, maybe just 1 or 2 things. It is very important for us to understand this and diagnostic guidelines, because it gives us accurate diagnosis. That means you're not thinking twice. You're not hoping it could be. You're not imagining, okay, or you're not even saying someone came to me yesterday with same symptoms, so this person could be dealing with, same. No, it gives us accurate diagnosis. It also helps us understand where our clients are, the stage at which they are struggling, what you can do, how you can help them, and how you can, at least progress with them. So it's important for every provider or professional to at least understand the ICD-10. Please, it is important for you to just, at least have it download it, just read through it, understand it, know how to be able to help your clients when you have one. It's very important so you don't diagnose wrongly. Earlier I mentioned the concept of mental health, and I mentioned 3 things, which is the biological, the medical, biological, and the social. All right. So the biological, the psychological, the social, they are what the combination of the biopsychosocial model of mental health. Talking about concepts is what builds a biopsychosocial model of mental health. Now, what is biopsychosocial model of mental health? Biopsychosocial models are a class of transdisciplinary models which looks at the inner connection between biological, psychological, and social environmental factors. Now, biological, I'm looking at genetics, inflammation, comorbid, metabolomics. It is very important for us to understand that this combination is what gives you the biological. All right. So genetic can be, you find an individual, maybe your client or someone who comes with maybe symptoms of someone who is struggling with bipolar disorder. You could trace through family, hereditary, yes. Somehow again, bipolar disorder can even start from that individual. So he might not even have the history. History starts with an individual. So he might not even have the family background or history or, like a hereditary or whatever. It could actually start from that individual. So it's important for us to understand the biological factors, which is the genetics. So yeah, again, if you have someone in the family who is probably struggling with alcohol use, yes, it's very possible, 50% chances that you'll find a son or a daughter who is also struggling with that that kind of disorder as well. Then schizophrenia, yes, if in the family or you have someone or the family history way back that someone has experienced or has gone through this whole process, of managing schizophrenia, it is also possible that a family member can inherit, which is 40%. There's that 40% chances that a family member can inherit. Now, looking at the environmental, yes, of course, disrupted family environment, neglect, isolation, trauma as a result of experience, or an event, sad event, malnutrition, infection can also be one of the factors, in looking at the biopsychosocial model of mental health. Then looking at the psychosocial factors, lack of affection and stability, care from caregivers. Of course, if an individual is struggling with something and there's no care, there's no support, there's no parental, backing, of course, the person will be struggling psychologically. Then lack of interactions with social environments. Of course, you're not able to really, be out there, communicate or do something. I give an example with this. Yesterday, someone called me and said, do you know that my neighbor's security man is actually like, he used to be my classmate back then in school. And so for every time I see him, there's just something I don't like the feeling. I feel like I need to hide, and all of that, psychological issues. Then social factors can be rapid urbanization, overcrowding, population, violence, when rural issues, poverty, lack of availability of health services, low education, lack of economic opportunities, and more. That is the social factor. So there are 3 factors, of course, one inclusive, which is the biological, psychological, social, and environmental issues that sum up to psychosocial model of mental health. So when we're looking at mental health, it means that we have to look at these 4 key things: biological, environmental, psychological, and social factors. So yes, earlier we mentioned that we're going to be discussing mental health and substance abuse. And we want to see the combination. I mean, why? What's the connection between mental health and substance abuse? So the connection, or rather the word for it, is called dual diagnosis, right? Yes, so dual diagnosis. So what is dual diagnosis? Dual diagnosis is a term used to describe a mental health disorder and a substance abuse problem. Dual diagnosis is sometimes referred to as a co-occurring disorder. It is important to note that someone can have mental illness and drug or alcohol abuse with no history at all. Still, they are considered dual diagnosis. When there is a pattern of one disorder emerging from or following the onset, then you can also classify that or look at it as dual diagnosis. An example of that is someone with schizophrenia or anxiety may begin self-medicating with drugs or alcohol as their fear. Hallucinations and paranoia become more uncontrollable. So if an individual is struggling with schizophrenia or anxiety, that person can start self-medicating as a result of what he's feeling, the symptoms, which is the fear, hallucination, and paranoia. it can get an individual to start taking drugs. But remember, something is under that is making that individual feel that way, but unfortunately maybe he or she wouldn't know, and they would just feel, once I take these drugs or whatever, I'll be fine. Now, according to reports published in the Journal of the American Medical Association, 50% of individuals with severe mental disorder are affected by substance abuse. 37% of alcohol and 53% of persons who use drugs are also diagnosed at least with one serious mental illness. Of all people diagnosed as mentally ill, 29% abuse drugs or alcohol. So more than half of all the persons with drug and alcohol use disorder are diagnosed with dual diagnosis. Both of these conditions produce upsetting symptoms that people often look to self-medicate, like I mentioned earlier, with mind-altering substances. So most times people feel certain things and they don't understand it. They just say, let me just take this medication. You know, when I take it, I sleep well. Let me just go ahead and take it. But not really addressing the main issue, you know, which is maybe the mental disorder or mental health issue. Now going ahead to take substance, you know, to maybe feel a certain way. Someone else may go through a period of depression following the death of a loved one and seek comfort in substance by abusing prescription medication or turning to illicit substances such as marijuana or cocaine. Someone else, again, may go through a period of anxiety following the experience from an abused marriage or relationship and seek comfort in substance by abusing prescription medications or illicit substance. Now, dual diagnosis is unique. I will say is unique because it depends on the unique history and the risk factor for each disorder. All right, so it means that every disorder or substance use, there's this uniqueness. There's something that brings someone who takes someone who is dealing with maybe schizophrenia, there would be something that the system or the body will like, you know. So there is this unique, you know, combination, or depending on a particular thing, not everything. So someone who takes someone who is taking marijuana might be struggling with schizophrenia. Now let's look at common dual diagnosis. Alcohol use disorder and depression, they go together. Depression and alcohol use disorder often occur together and can worsen each other's symptoms. Now, you don't even know if it's depression or it's the love for alcohol, but because they go together, so it becomes like a daily or, you know, a lifestyle. I've heard people say this to me like so many times, like, you know, I can't sleep, but once I take that, my 2 bottles or 3 bottles, I'm okay, you know. But yet the problem is still there because you're taking it because of something gets you to that point where you have to take it. Because if an individual says to you, you know, I can't even sleep, I don't sleep well until I take this alcohol, then of course something is there. But because he or she's not aware, they just feel, that's the only thing that makes me sleep, you know. So they take it to just ease or calm themselves and be able to sleep. Methamphetamine use disorder and post-traumatic stress disorder, they go together. Individuals with a history of trauma may turn to methamphetamine as a coping mechanism, leading to coexisting PTSD. So it means that for someone struggling with post-traumatic stress disorder, he would enjoy the feeling of methamphetamine, you know, at least it will make him forget that thing at that point, you know, just get him to that point where he wants to be at that, you know, point. Then marijuana use disorder goes with schizophrenia. For this, I can relate well because I remember sometime around my family house in Kaduna, there's this young man who is always on the street. And, you know, I asked the question, so what happened? So why is he like this? Because we grew up together, practically we grew up together, so I know him, like, you know, but all of a sudden he's on the street. What happened? What changed? And they said, okay, so he's been taking drugs. Of course, they have clique of friends that they take drugs, you know, but some of them are not even here. Some of them have traveled abroad. Some are okay, some are still here. But unfortunately for him, one of those days they went to take, and you know, I think he took more than what he was meant to take or whatever of marijuana, and unfortunately he's on the street. But his other friends that they were, you know, doing this together have moved on. Everyone has, you know, at least they're all doing other things. Now for him, unfortunately, I'm sure he probably had a genetic problem or history that he didn't know about, you know, and unfortunately that he's on the streets, you know, in Kaduna roaming. I know that there are so many people struggling with this lack of awareness. Now, opioid use disorder and anxiety. People who suffer from anxiety disorder often turn to opioids due to the sedative effect. Yes, this again, I can relate with this. I know of someone who most times he will tell you, I'm sorry, I had to take this because I could hear voices, you know, that anxiety, you know, disorder, you know, but unfortunately, of course, the person wouldn't know, and he feels once I take these drugs, I feel a bit better. I'm able to sleep for a couple of days, and then before again, or when I have like a real like project ahead of me, I feel like I need to take these drugs because I'm not sure I can execute them, you know, without taking these drugs. The fear of, you know, what is ahead of me makes me go to take this. So that's, you know, at least not knowing that it is something that gets you to taking that drug. Is not because you are afraid, but because there is a mental disorder. Now, signs and symptoms. When you use drugs to cope with psychological distress, it is one of the signs and symptoms of substance abuse and mental health disorder. If your psychological well-being is dictating your desire to abuse drugs or alcohol, you may have dual diagnosis. It's possible, you know, that that individual is stressing with either depression, anxiety, struggling with either depression, anxiety, and all of that. Because if you feel that you have to take drugs to continue your daily activity, then something is not right somewhere, because the end result is it gets you to that point where you're at the risk of becoming an addict, you know. Then the second one is if you have a family history or mental illness. Like I said earlier, mental illness can be something that develops as a result of something environmental. For example, a person can develop post-traumatic stress disorder as losing their home to flood, fire, bandits, you know, and all of that. This I can relate again. I know that with this little research, I can imagine how many people are struggling at the IDP camp, internally displaced camp. I can imagine how many people are struggling with this, you know, because of maybe one thing or the other, and they have to all move to a camp where, you know, thousands of people are all living together. You know, that can also be, can also cause mental illness, and then maybe hereditary, like I mentioned earlier. Then it is also important to note that if you feel like you can't function without drugs or alcohol, you may have drug diagnosis, because when mental illness and substance abuse use disorder are happening same time, you feel completely out of sorts in regards to your emotions and behaviors, and then most times you say, it is when I take this that I feel this, then it is possible that that person is actually going through dual diagnosis, and there's a need to please, you know, quickly seek help. Another symptom is when you become deeply depressed or angry when using drugs or alcohol. This, again, I can tell a story. So when an individual takes drugs, of course, this person is very calm. He's always okay. When you see him, he's fine. He's not, you know, you don't even know that he's going through anything. But once he's under the influence of drugs or alcohol, he starts to fight. He picks up knife. He wants to just stab someone. You know, you see, you know, a different human being. You know, you don't see that person that you've always seen. The person might truly be going through depression. That's what dual diagnosis is saying, because that path of, you know, that person is coming out as a result of the mental health issues. So it is important to please, just in case you know someone or someone around you struggling with this, then maybe the person needs to quickly seek help. Then another sign is if you had symptoms or mental illness prior to your substance abuse. It is common for people to think that becoming addicted to drugs and alcohol causes a person to develop symptoms of a mental health. Well, maybe not. For many, that is exactly what happens. But for several others, symptoms of mental illness were present prior to the substance abuse. Dual diagnosis says you can be feeling depressed and taking something just to cover it. But the main thing is, have you gone ahead to find out what is getting you to that point of depression? There's a need to attack the root, which is that mental issue, so that at least when dealing with the substance use, you know that you are working on two things: the mental health and then the substance use. Other few experiences are as follows: change in behavior. If you find someone or struggling with changes in behavior, then maybe the person is struggling with dual diagnosis. Continue to abuse drugs. Yes, sometimes you hear people say, oh, I've been to the rehab once, twice, 3, 4 times. Yes, maybe there's an underlying factor that has not been, really taken care of. So there's a need to also say, we need to look out for the root cause of this problem. Then becoming isolated from others can also be, and then suicidal thoughts is also a symptom. Now, looking at substance abuse, there are types of addictions. There's drug, there's alcohol, there's behavioral. And then for drugs, we have the street drugs and then the prescription drugs. Let's move to finding out what substance abuse is. And the first definition is, what is drugs? Drug, according to World Health Organization, WHO, is any substance that, when taken into the living organism, may modify one or more of its functions. All right. So yes, you take drugs and then there's an alternation. Something just changes, in the whole system. That is what drugs is all about. So it's either it's fixing something or it's messing up with something, maybe. Now, drug abuse is, as National Cancer Institute describes it, they say drug abuse is the use of illegal drugs or the use of prescription. Like I said, it's either you take it, to work on something, or you take it to probably destroy something. It's the use of prescription or over-the-counter drugs for purposes other than those for which they were meant to be used, or in excessive amounts. Drug abuse may lead to social, physical, emotional, and job-related problems. So it means that if an individual is struggling with drug abuse, he might be struggling socially, he might be struggling physically, emotionally, and even, relating with, his peers and having issues with his job. Now, drug dependence occurs when a person needs one or more drugs to function. So when an individual is struggling with an underlying factor, which is a mental health issue, and then he feels that it is only when I take this that I feel a certain way, then, or maybe the body is already used to a particular way when they feel certain things. So when they start to hallucinate or when they're afraid, you feel, I quickly need to take this because that's the only way I can feel good. Then you know that the person is dependent on drugs. Types of psychoactive drugs. Of course, we have the narcotics, we have the stimulants, cannabis, hallucinogens, and then depressants. Narcotics are the heroin, codeine, anything that has to do with that makes you just feel a certain way, whether it's numbing a pain or whatever. That's narcotics. Then depressant is just like I mentioned earlier. People will tell you, oh, when I take my 2 bottles or 3 bottles, I'm very okay. I sleep well. That's antidepressant. The person is taking something as a result of, you know, an issue. Then stimulant is, but sometimes people, when they take them, you know, they feel either they are afraid, they are anxious, you know, nervous, and all of that. So it calms them, stimulants, okay? Then the cannabis, and which is people who take weed, you know, and all of that, to just maybe make them feel a certain way as well, either to make them feel good, mood, change their mood, and all of that. And then again, the hallucinogens, for, you know, people who just feel, I'm struggling with mood issues, I don't feel good today, you know, I've been having mood swings, I've been feeling a certain way. They go with this in most cases. These are types of psychoactive drugs. Now, the risk factor of drug addiction: 1, it is highly addictive. 2, weed is available, so it's everywhere. 3, gender. Female, most unfortunately, when women take drugs, it affects them more. Then there's the peer pressure, anxiety, lack of family involvement, family history, and all of that. Then the impact of drug abuses: health problems, accidents sometimes, unconsciousness, crime rates. Most times an individual will say he doesn't have money, you know, that's the risk factor. Work performance, you're always not at work, you're giving excuses. School performance, you're not able to do stuff. Family problems, families are having issues, and all of that. Now let's look at the pattern of substance abuse in Nigeria. Now it says 40% of Nigerian youth deeply involved in drug abuse between age 18 and 35, according to NDLE. It also says 29.4 million Nigerians from age 15 to 16 are abusing psychoactive substance. All right, so we have a few, also another review from Fario, she says that so many Nigerians are abusing stimulants, hallucinogens, narcotics, and sedative drugs, you know, just to feel a better way. Now, what's the way forward? Prevention of alcohol and drug abuse. Now, I said legal. It is very important for us to know that NDLEA is there to make sure that these things are being monitored, they are being watched, they are being, every individual is going by the laws that governs the nation. So if we have NDLEA that is supporting this, then it's good for us. It is also very important for us to understand that they can help through these channels: support supply reduction, of course, demand reduction, access and control, very important, and then educational approach. And that's what we're doing today, educational approach. Educational approach can be in different dimensions, okay? We have the community-based programs, we have the home and family-based measures, we have the educational programs, and then we have the school programs. There's a need for us to focus and really create more awareness in schools, offices, wherever, because mental health is everyone's business. So it means that you can't say, oh, this session don't need this. Every one of us needs mental health awareness. And in terms of mental treatments, of course, we have the psychiatric hospitals, and then we have the resident mental health facilities. We have the outdoor outpatient mental health treatments. Okay, so outdoor, I will advise that it's important for us to understand that it should work for people that at least have solid support system. So if an individual doesn't have solid support system, please, he should be advised to check into a residential mental health center or a psychiatric hospital. Now, mental health service support for dual diagnosis, it means that if an individual is struggling with dual diagnosis, he will need medication and psychotherapy. Medication is never enough. Psychotherapy support. So it is very important for us to understand that while we're dealing with our clients who are struggling with substance use, it is also important to have counseling sessions regularly. Counseling sessions does not necessarily mean just the counselor all the time, but it requires family group counseling so that the family will understand how to manage that individual struggling with all of these issues. Now, my conclusion is, I said, break the silence and end the stigma. And that's what we're doing today. Again, creating awareness, trying to end the stigma. Mental disorder can be prevented through stress management programs in their early stages. And then substance abuse can be prevented through various approaches. Mental health treatment and service support can be assessed through different approaches. It is important for us to understand that when we keep talking about mental health and substance abuse, we'll be creating more awareness, we will end the stigma, we'll help people come out of their struggling situations, and we'll also give people voices to come out and say, I need help. So it's important for us to go through this process. And I want to say thank you so much for this great privilege. I pray that we'll continue to champion and, you know, talk on mental health and drug use. I pray that the organization will keep doing what it's known to be doing. Thank you, ISSUP, for this opportunity. Thank you, Dr. Martins. Thank you, Olivia, for this easy technical support. And to everyone here, please, I'm available for questions. And thank you very much and have a beautiful day.
Well, thank you so much, Saadatu, with so much energy and passion. You have done so well. Thank you for the excellent presentation. Well, time is not always our friend. I think we would have scheduled this session for 2 hours. Well, in any case, we'll be monitoring the chat box to see how many questions we have there. There seems not to be much beside the comments that have been made. What time will not permit me to summarize the key points that you have highlighted today. But what is very important is that we say, from what you have said, it is good that we pay attention to our state of health, particularly mental health, because there is no health without mental health. I think that is the summary. So we should focus on those things that have been pointed out by the speaker, so as to avoid mental disorders or to prevent mental disorders. Well, if I still have time later on, I could more or less throw lights, maybe share some other key points that I gathered from your presentation. So at this point, let me call on Ejikeme to take us through the Q&A session, because time is already fast spent. Ejikeme, over to you, please.
You're on mute.
Ejikeme.
Okay. Okay. Yeah, thank you so much, Dr. Martins, and thank you so much, Dr. Saadatu. We have this very interesting question from Gloria Vincent, and her question is it advised for the caregivers to start prescribing a medicine for a person with mental illness the very first day or second day of meeting?
No, in my own opinion, I will say no. You can't start administering medication. You have to go through the process. You know, you have to make sure that you're able to diagnose your clients. You don't just go through medications because the person has said, I feel a certain way, and then you're assuming because I gave Mr. A XYZ yesterday, and for that reason, this can go with this person. No. And that was why I mentioned the ICD-10. It is important for us to study it, so we'll help people understand, at least be able to have accurate diagnosis, please. And it is also, I will say this again, if you are not a clinical psychologist, please do not administer medications, please. It is good for us to refer. As a counselor, I will say I don't administer medications. What I do is I refer. If I know that my client needs medication, I refer to where my clients can get medications. But I know that for sure I can come up with a diagnosis so that when I'm referring, it'll be easy for that individual to also go through the process and know what exactly the client wants. But it's not also stopping whoever I'm going to refer to also do his job, you know, trying to find out what exactly is going on. So please, I would say, no, you don't meet someone the first time and then you just go ahead and administer. Give that person the opportunity to, you know, exhaust all avenues. Be sure of what you are dealing with first.
Okay. Yeah, I think that's an interesting answer. We have another question, probably going to be our last for today, from Sandra Mali. And her question is, there are some countries that already have legalized some drugs. So what can we do about that in order to stop such kind of a thing happening in other countries?
Okay, so I will say that one of what we can do is what we're doing today. Until we create awareness, until we help people understand what these things are, the risk factor, okay, the negative effect, the impact, then we can help individuals that are already taking this to say, I want to, even if the law says, the government says it's okay to take it, I want to personally tell myself that I don't need it because of the, at least, you know, awareness or education, you know, that I have at hand. So it's important for us to keep creating awareness. It is also important for us to also keep engaging, you know, with, you know, NGOs, CSOs. Let's keep talking. Let's see how we can, you know, broaden this conversation. Let's see how we can support countries that are already doing this and see how we can continue to educate people on personal decisions that they need to take concerning their lives.
Well, I think when we're about to round up on the question sessions and they are just tripling in now. Okay, let's take one more before we wrap it up here. From Sadia, she asks, I'm a clinical psychologist. Do I have to recommend medications to clients?
Okay, so as a clinical psychologist, if your client comes to you, of course you know what to do. You know how you want to diagnose your client. You know if you want to give your client medication. But I will speak from my own point of view as a mental health counselor. I cannot, administer or ask my client to take medication. I can only refer to a psychologist, a clinical psychologist. So yes, maybe she can if she wants. If she wants to send to a psychiatric doctor, if she's not sure of what she's doing, if she's also needs someone to work with, then it's fine. So it depends on how you work. It depends on what you want to do. But as a clinical psychologist, yes, you can. If you feel that your client needs medication, but as a counselor, no, you cannot. You can only refer.
Okay, thank you so much, Dr. Sadatu, for those intelligent answers to these questions. From Fazana, he's asking if he can get the presentation. Yes, we are going to have the presentation, the slides at the end of this webinar. And on this, over to Dr. Martins to do the wrapping up of the session. Thank you so much.
Yes, thank you so much, Ejikeme, for taking the Q&A session, and thank you, Dr. Adamu, for responding to the questions. Let me add one or two points to the issue of prescription. I think that has to also do with the prevailing policy or laws in different countries, especially that this is an international webinar. There are participants from different countries, so it depends on what the law provides. In Nigeria, I know that beside medical doctors or consultant psychiatrists, other practitioners in the field of mental health, like the clinical psychologists and social workers, are not by law allowed to make any form of prescription, especially for beside what we refer to as the over-the-counter medications. If they are controlled medications, they have to be prescribed by physicians, medical doctors, or certified clinicians in that area. So beside that, in some countries, addiction counselors or psychologists are actually by law permitted to prescribe. So that also depends on the prevailing laws in different countries. And let me also say too that is why addressing substance use issues, whether substance use disorders or mental disorders, requires a combination of therapists. What I mean is different professionals coming together to play their different roles. You have the psychologists playing their roles, you have the sociologists playing their roles, you have the case managers playing their roles, you have this consultant psychiatrists, the general medical practitioners, and so on. So everyone has his or her role, and everyone knows where his or her limits. So in that case, it makes management of mental disorders and substance use disorders more easier, in a collaborative way. So I want to believe with that, in summary, it depends on the prevailing laws and policies in different countries. Once again, I want to thank participants for joining us in this session. Sadatu, you have done so well. I want to believe that we'll have another time so that at least we set aside more than 1 hour for the session. Ejikeme, thank you once again, and to Olivia, Radolf, and colleagues from ISOP Global, thank you for always being there to support us. So let's look forward to another session again in May. As I say, thank you all for being part of this session, and bye for now.
Thank you. Bye.